Good evening, and thank you for joining us for the American Academy of Neurology's Neuropathways webinar. My name is Natasha Hamilton, and I am a fourth-year medical student at Rocky Vista University in Parker, Colorado, entering the match for neurology this cycle. The first 15 minutes of this program will focus on specialty insights from each of our panelists, and we will move over to general career advice and have 15 minutes at the end for you to ask any questions of the panel. Please utilize the Q&A feature. I'm excited to introduce to you today Dr. Erin Berkowitz, Dr. Esiosa Ighodaro, and Dr. Julie Schwartzbard. Dr. Berkowitz is a professor of neurology at the University of California, San Francisco, where he serves as a neurohospitalist, general neurologist, and clinician educator at the San Francisco VA Medical Center and San Francisco General Hospital. He previously served as director of global neurology at Brigham and Women's Hospital and associate professor of neurology at Harvard Medical School, where he directed the first-year Mind, Brain, and Behavior course. We also have Dr. Ighodaro, who is a neurology stroke fellow at Grady Emory Hospital. She is a native of Kentucky, where she graduated with honors and summa cum laude with a Bachelor of Science in Biology and minors in Chemistry and French from the University of Kentucky. After graduation, she matriculated into the combined MD-PhD program at the University of Kentucky College of Medicine, where she was the first African-American female to complete the MD-PhD program. And we have Dr. Schwartzbard, who is a neurologist in Aventura, Florida, where she has been in private practice for 25 years. She is board certified in brain injury medicine and is a voluntary assistant professor of neurology at the University of Miami School of Medicine and a clinical assistant professor at the FIU Herbert Wertheim School of Medicine. Her clinical research includes Parkinson's disease, Alzheimer's disease, migraine, neuromuscular diseases, and other neurological disorders. She also has an interest in traumatic brain injury and participates in the NFL Concussion Settlement Program. As a reminder to everyone, please submit all questions in the Q&A box. And with that, I will hand it over to Dr. Schwartzbard.
Thank you, Natasha, and thanks for that introduction. So I was that kid that always knew I wanted to be a doctor, probably from the age of 5. The only problem is I really never thought it through beyond that. So when I got to my summer before my 4th year of medical school, into my 4th year, everyone's picking their specialties to apply, and I was completely clueless. So there was a questionnaire, this multiple choice questionnaire that was going around. You sort of filled it out and it sort of spit out what your specialty was supposed to be. And so I filled it out. I figured, what the heck? I don't know what I want to do anyway. And it spit out physiatrist. You're supposed to be a physiatrist. It's like, all right, what's that? What's a physiatrist? So I learned about that. It's about rehabilitation medicine. I said, okay, that's what I'll do. That's what the questionnaire says I should be. It turns out I was in South Florida at the time, and for family reasons, I needed to stay in South Florida, and there's no physiatry program in South Florida. I soon learned that there's something called neurologic rehabilitation. You can do a neurology residency and then a fellowship in neuro rehab, and I could basically be a physiatrist at the end of the day. That was my plan. So, as I'm sure you can all imagine, I was windswept by my neurology residency. And the truth is, it's now been 30 years, and I'm still a passionate neurologist. I hope that doesn't sound corny, but it's the truth. I did a neuromuscular fellowship, and that served me well, but I have evolved over the years. And as you heard in the introduction, I do have a very strong interest in neurodegenerative diseases and TBI, where I have learned, where I do quite a bit of clinical research and have sort of landed in my happy place. So I guess sort of the circuitous story is one way of telling you that there's no one way to get where you're supposed to be. And some of it sometimes is serendipitous or organic. And I just hope all of you get to follow that path, you know, according to the plan that is meant for you. Dr. Berkowitz, I think you are up.
Well, thanks for inviting me to be part of this panel, and thanks to everyone who joined. And great to see Esiosa, who I know through social media, as doing amazing neurology teaching work. So if you're not following her on social media, there's a lot to learn from her. And glad to see you. I think probably the first time close to in person, and nice to meet Dr. Schwartzbard and Natasha as well. And so my path was a little circuitous. I won't get too much into those details, but as far as neurology, I, like Julie, started thinking I wanted to be a doctor for no particular reason as a kid. There weren't any doctors in my family, just one of those things. And then I kind of, by the time I had done my pre-med, wasn't really sure I wanted to continue on that path, but had already applied to medical school and was 21 or whatever, and figured I was doing the best I could. I would go ahead with it. But I actually left medical school for many years and tried out some other things. That's a story for another evening. And then I found my way back to medical school for a variety of reasons. That's also a long story for another evening. But in any case, I had always been generally interested in the mind and the brain. I guess I have to say, in medical school, I don't know how many of the participants are medical students versus pre-med, but you do spend a year sort of spending a month or two in each specialty, for those who may not know. And I kind of liked everything for different reasons. Everything's so different. There's not probably too many careers where you get to sort of try on each thing and see what it's like and how the people are and what you do in a day. And it's all pretty interesting. I mean, doing surgery is pretty interesting. Doing anesthesia in the operating room is pretty interesting. Neurology is interesting. OBGYN is really interesting. Lots of new lives happening all the time, all around you. I thought that was pretty exciting. And neurology made sort of intellectual sense to me as a choice because I like the mind and the brain, and I knew I wanted to take care of patients over the long term and to interact with them when they're awake, which is less of what is done in the operating room. I remember not being entirely excited about it, and I thought to make a career choice for the rest of my life, I should be more excited. And luckily, I had a very thoughtful dean of student affairs who was also a psychiatrist, and asked him, I said, I really kind of was the most excited about my OBGYN rotation. I thought it was the most fun and interesting and lots of adrenaline and lots of exciting things happening. And neurology, I thought it was interesting, but I didn't feel necessarily so emotionally drawn to it. And he said, well, this whole kind of go with your gut thing, this is kind of popular psychology, but sometimes you make decisions more based on what makes sense intellectually, and it doesn't have to necessarily have some strong visceral response. And I thought that was wise advice, and neurology made sense for a lot of reasons. And I went ahead with it, but with some ambivalence, I think, because you only get to try it on for 4 to 8 weeks as a medical student. But fortunately, and probably much to my surprise, I ended up really falling in love with neurology during my residency. And I'm now 10 years out of residency in a couple of months, and just continue, as Julie said, to absolutely love it, find it fascinating, learn every day. Some people wonder, should you choose a specialty or sort of stay general with, general medicine, general pediatrics? That you're sort of narrowing your life choices, but our specialty is so vast. You could spend many lifetimes not knowing everything. And every day I learn new things and get to work with amazing students and residents, and learn things from them, learn things from our patients. And I'm always still very excited to go home and try to figure out what's going on with these patients and read more and talk to colleagues. So it's a really wonderful field, and get to work with patients really struggling with, in many cases, very challenging diseases and challenging moments in their lives, which is very meaningful and impactful. And sometimes the neurologist is the one who figures it all out and can help the patient get a lot better, or get an answer to something that was otherwise not there. So I've found it, much to my surprise, as someone who is somewhat, as I said, I left medical school for 6 years. I was out longer than I was in, and never thought I would really like it so much, but still jump out of bed every day excited to see what I'm going to learn, and from my patients, and what I'm going to get to learn with my colleagues and students and residents. So hope that's helpful, and curious to also hear Dr. Igodara's story.
Hi, everyone. Thanks, Ashley, for the invitation. Thanks, Natasha, for the wonderful introduction. Julie, it's great to meet you virtually. And Erin, I'm a huge fan. I have all your books and For those who don't follow Dr. Berkowitz on social media, you should follow him. You probably have one of the best neuroanatomy, clinical neurology textbook out there. So thanks for all the work that you do with regards to education. So for me, I was always really interested in science at a very, very young age. My mom used to always tell me that I would take all of her kitchen ingredients when she wasn't around. I would usually do it at nighttime when everybody was asleep. I would just take a bunch of leftover kitchen ingredients, pretend I was a chemist, and just make experiments and stick them behind the freezer, hoping she, wouldn't see the next day, and then, test all my hypotheses. I'm at a very young age. So she always said you have a very scientific, inquisitive mind. And then in elementary school, high school, I was always really great at science. So a lot of individuals said, if you're great at science, you should consider a pre-med career in college. So I majored in biology, took some classes in chemistry, really enjoyed the pre-med curriculum. And so I kept going, toward the pre-med route. And I also had a professor that said, you love asking questions, you should also think about graduate school. And it wasn't until junior year in college where I started, someone said, you don't have to pick between grad school and med school. There's a combined degree program that you could apply for. So, okay, great. I'll just apply for all the combined degree programs so that I don't have to pick between, being a physician and then being a scientist. So I was fortunate to get into the combined MD PhD program at the University of Kentucky. And so how that program works, it's an 8-year program, but it's all expense paid, tuition, room and board, everything. And you get a stipend as well. So then for how it was at Kentucky is first 2 years were clinical courses. Then the next 4 years were grad school. Then you come back and you finish your last 2 years of rotations. So for me, how I fell into neurology was actually during the first 2 years of like foundation work. And it was in my neuroanatomy course, and everyone is, neuroanatomy can be very, very hard for a lot of medical students. It was hard for me, but I just fell in love with the topics. I fell in love with localization, with the brain, with the nerves. I just really, really enjoyed my classes. So much so that I had a notebook where I would, in class, I would just write down, all these different questions I would fantasize about. But what happens if this is lesion? And what happens if you do this or if you do this? And then I would go to my professor's office hours. We would just sit and they would just answer all of my questions that I had in my little notebook. So that's how I fell in love with neurology, did my PhD in neuroanatomy and neuroscience. And then I came back to the clinical rotations and fell in love with the neurology clerkship. And then I matriculated into neurology residency. And now I'm a stroke fellow, about to finish in a couple of months and look for my first faculty position. So I think my recommendation for those who are listening is to really follow your passion and what are you interested in and what gets you up, in the middle of the night that you're excited to learn about, and then trust that and then keep finding ways to continue that learning.
Thank you so much for describing your path forward to all of you panelists. Our first set of questions surround your subspecialty. So I would want to start with maybe if each of you would go through your subspecialty, some challenges, rewards of the subspecialty, and maybe why you tended to choose that over others. Does that make sense? Okay, we'll start with Dr. Schwartzbard.
Sure. The neuromuscular disorders, much like the rest of my career, sort of fell in my lap when, it was very different back in those days where it was just sort of like, do you want to do this? Okay, I'll do it. It was not as formal as the process is today. I loved it because I love peripheral neurology. I loved EMG and nerve conduction studies. But like I intimated earlier, and I think it's one of the advantages of neurology is you're not sort of necessarily beholden to that subspecialty, because as much as I still do EMG and love that subspecialty, I've been able to expand and grow and sort of invest myself in other subspecialties like behavioral neurology with Alzheimer's and movement disorders with Parkinson's and traumatic brain injury. So I think it can be very fluid once you choose that one specialty. There's no rule that you can't evolve and explore other options.
Great. Let's hear from Dr. Iguodaro.
Thank you. For me, the reason I chose stroke is I liked all the settings that neurologists practice in. So we can practice in the outpatient setting, we can practice in the inpatient, we can practice in the emergency room, and we can also practice over the computer, like virtual. And stroke provided that opportunity to be able to practice in all those different kinds of clinical settings. On top of that, I'm really interested in health disparities. And stroke, there's a lot of health disparities along race, ethnicity, gender, socioeconomic status. So I was also able to still continue that work in like health disparities and advocacy in stroke. So that's for me why I chose stroke as my subspecialty.
Thank you. And Dr. Berkowitz, what about you?
So I am not a subspecialist. I'm a general neurologist. So again, as was mentioned earlier, some people, when they're thinking about choosing a specialty, wonder, well, should I stay general if you kind of like everything a little bit and you get concerned about getting too specialized in your career or in life? But as I think you're hearing from Julie and Esiosa, neurology is still vast. If you choose neurology, you can do something very high adrenaline, like stroke, where you're still running to emergencies or neurocritical care. On the other extreme, you can do sleep medicine, where you are studying people who are asleep. No less exciting, no less interesting, but very different. You're not going to probably get paged on call overnight to manage a sleep issue. And then everything in between. You could specialize in patients who have diseases of the peripheral nervous system, the nerves, nerve roots, neuromuscular junction of muscle, as Julie does, or patients who have dementia or movement disorders. So there's really a lot of career paths and lifestyle paths, even within neurology. So it's seems like at the end of medical school, your path is narrowing, but actually there's still a lot of ways it can expand. Since as I mentioned, took a long time out of medical school. By the time I finished my residency, I presumed I would do more training. Most people do more subspecialty training. And again, I kind of liked everything, but I was also getting ready to be done with training and start working. But like most things, serendipity, I started residency thinking I would probably do behavioral cognitive neurology, both interest in clinical side of it and research and sort of Oliver Sacks, man who mistook his wife from a hat, and these things that inspire us to get interested in neurology. And one of my great mentors and one of our professors, an extraordinary general neurologist, Marty Samuels, who sadly just died in the last year. When I saw him able to really discuss any case and go to the bedside and have an approach to almost anything, I really thought that was pretty incredible, and thought it would be, and I also saw the value of general neurology. All the specialties are very important, but as neurology gets more and more subspecialized and people need to spend their entire life thinking about stroke because there's so much to know and do and so many studies coming out every day, week, month to keep up with, there are fewer and fewer general neurologists who are committed to seeing the patient that we don't know yet, if they've had a stroke, or if they need to see Julie for an EMG, or where to go next. And so I found both the hospital and the outpatient setting very interesting. And so there are some neurologists who practice just in the hospital, neurohospitalists. And so I do practice a lot in the hospital, but I also like the outpatient setting to see patients over the long term who don't yet have a diagnosis, or maybe are seeing a neurologist for the first time, or maybe have seen some subspecialists who have said, no, this isn't my subspecialty, try this one. And a few have said, actually, maybe go back to the beginning and see a general neurologist for a fresh look. So maybe worth mentioning briefly my practice environment. Also, I'm like Esiosa, very interested in health disparities and underserved populations. So I've done some work for many years in Haiti, which, as people may or may not know, has unfortunately gotten extremely violent and dangerous in the past few years. I've not been able to go there, but also work in the rural US. So I work for the VA. For those who are not familiar, that's this is the health system in the US that takes care of our veterans from the armed forces who have been deployed or worked in the military. It's a very maybe less recognized, underserved population, very rural population. I am in San Francisco. That's not my picture behind me, but I'm pretty close to the Golden Gate Bridge here at the VA, but we serve all the way up to the Oregon border. So we're in Northern California, but there's about 400 miles left, and a lot of veterans, due to trauma they've experienced and other reasons, live very rurally and difficulty accessing care. And so I work with that population, and then also work for San Francisco General Hospital, which is our city county hospital, which like Grady, where SCOSA works, takes care of the underserved patients with challenges accessing healthcare in an urban setting. So there's many practice environments you can work in. When I was in Boston, I worked in a big university hospital. And so now I'm in different practice environments that serve different populations as a general neurologist.
Thank you for that. Our next question is asking about your day-to-day schedule. If you could describe what your daily schedule looks like, or if you're in a practice environment where it is drastically different, maybe go over briefly what your week would look like. And we'll start with Dr. Iguodaro.
Thanks. So it's going to be different because I'm still in training. So as a stroke fellow, there are specific requirements that you need, in order to say you're, board certified stroke physician. So based upon that, we have like different blocks. And so right now I'm working at Grady, where we spend many of our time in the acute care. So I get up, from 7 a.m. to 6 p.m. I'm in the hospital taking care of acute strokes. So what'll happen is I'm carrying a pager, and if there's an acute stroke anywhere in the Grady hospital, then I'm responsible for going down and assessing that patient for stroke. And if I think that they're having a stroke, then we'll get imaging, we'll do an exam, and then we kind of figure out, are we going to give this patient medicine? Are we going to take them to what we call the angio suite to try to remove the clot if there's one? And then figure out, after we do those treatments, where are they going to go in the hospital? So I do that from 7 a.m. to 6 p.m., carrying the pager in the hospital. And at nighttime, sometimes I can be on call where I'm at home, I'm still carrying the pager. So if a stroke comes overnight, I'm still helping the resident try and figure out how are we going to treat this patient. And then once I have a plan, I talk with my supervisor, who's called an attending, and then we'll figure out what's the best treatment for the patient. So it's that's kind of how my day works. And so sometimes I'll be on the inpatient side, and then there'll be other times within the week where I'll be seeing patients on the outpatient clinic side. And how that works is a patient will come to our clinic. They may have had a stroke. I'm going to look, trying to figure out how they're doing from their stroke standpoint, talking with my attending and trying to help them prevent another stroke from happening. So that's kind of how my day is. It's very heavy on the inpatient. You're carrying the pager a lot. But I've enjoyed learning and helping and taking care of patients that have acute stroke.
I got to ask you, here we are in 2024, you still have a pager?
Well, now the pager is on our phone.
Okay.
We're the last profession. Do you still use pagers, fax machines, and CD-ROM?
There you go.
Okay, and we'd love to hear what a day in the life looks like for you, Dr. Schwartzbard.
Yeah, so that has evolved over the last 30 years. I was, the first part of my career running from the hospital to my office back and forth. I think those days are not as frequent as they used to be. It's interesting to hear you, Aaron, talk about how you do both hospital and office. It seems like people are sort of picking their corner these days. And then I just sort of was like I just sort of saw tons and tons of patients for many, many years. And then, like I said earlier, I've sort of, now morphed. So my day is a little bit more varied because I have my clinical research, and then I have my office patients, and then I like to teach and go down to the University of Miami and work with the neurology residents. So it's a lot more varied than it used to be. I think when you're first going into medicine, you sort of have this idea of how it's going to be. I always encourage the residents of the University of Miami, I say, go to an office, go to a doctor's office and see what it's like to practice neurology in that setting, because that's what most people end up doing. And it's very foreign to them in terms of their experience in residency.
Thank you. Thank you. And now for Dr. Berkowitz, what is a day in the life of a general neurologist?
Yeah, so like the others, my weeks are different from week to week. So my position, so I'm at UCSF, University of California, San Francisco, as a faculty member, but our faculty staff 3 hospitals, the 2 I mentioned, the VA and San Francisco General, and then also the University Hospital. Many of us work at 2 out of the 3. I'm not sure there's anyone who covers all 3 places, but I work, as I mentioned, at the VA and San Francisco General, and the UCSF medical students and our UCSF neurology residents rotate at all 3 places. So I'm a clinician and educator. I don't do any research or anything like that. So I think it's about 15 weeks of the year I do inpatient neurology, either on a ward service or a consult service, either at the VA or at the general. And these are teaching services. So at the VA, we have 2 residents and 2 or 3 students. At the general, depending on the service, 1 or 2 residents and then 1 or 2 students. So on those weeks, I'm coming in, hearing about cases that were sent home overnight from the emergency room at our morning report, and then making rounds through the hospital with our residents, seeing patients who've been in the hospital or new patients, examining them with the residents, doing some bedside teaching, those sorts of things, meeting with our multidisciplinary teams of nurses, social workers, physical therapists, occupational therapists about our patients and how they're progressing in the hospital. We're hoping they will go after the hospital, whether that's needing rehab or going home, or in some situations, maybe needing to think about skilled nursing facilities. And then in the afternoon, maybe doing some teaching with the residents or students, or if things are busy, everyone retreating to their corners and writing their notes and doing their work and touching base later in the day. That's an inpatient week. And then my outpatient weeks are split between these 2 hospitals. Most of my outpatient work now is done in resident clinics. So they're teaching clinics where the resident is seeing the patient and it's their patient, but they're not fully board certified in neurology yet. So they're supervised. So they'll see the patient and then come out and tell me what they think and what they saw, and we'll talk, and then we'll go see the patient together and then talk about it, and they'll finish up. And then interspersed in there are other things related to teaching the residents at the VA. I do our morning report where we hear about interesting cases, or the residents say, can you go over this topic, or can we go see this patient together in the emergency room who we're confused about? So those are sort of more educational activities. I think those are the main things. Any other things I do? Oh, so for the VA, I mentioned very rural population that we serve through telemedicine, as the COSA mentioned, and through video and phone, but some patients need to be seen in person still, despite all the wonderful technology. And so I've started a clinic I'm doing now just a couple times a year, where patients we see by phone or by video in San Francisco and say, I think we really need to see this patient, but either they can't get to San Francisco or don't want to come to San Francisco. I do one clinic a few times a year up in Clear Lake, California, which is about 3 hours north of San Francisco, 2.5, 3 hours, depending on traffic, to see patients up in what's called a CBOC, which is a community-based outpatient center run by the VA. I think those are most of the different ways I spend my days and weeks.
Thank you for that overview. I loved hearing the variety between all 3 of you panelists and what practice settings that you might be working in. Now moving on to some general career advice. What advice would you have for medical students that are considering neurology? Start with Dr. Berkowitz.
Oh, great choice if you're considering this, as you can hear from all 3 of us doing this, who are, Julie's been, I think you said 30 years, for me 10 years, and SEO says still in training, the tiring and most hardest part, and still smiling and so excited about it. So we all love this field, and we'd be excited to welcome you to it. And I can't say I've ever met a neurologist who doesn't like it or who got bored. I think other people can agree. It's pretty interesting. It's pretty fun, and it's certainly never boring. I don't know if anyone else as a kid felt like what if my job is boring? You maybe see your parents' jobs or your uncle's job or something. That looks boring. It's never boring. That's one thing it most certainly is not. So what advice would I have? Well, if you're interested in neurology, most medical schools have a rotation in neurology. So, but some do not, I've learned. And so to try to find a way to have a neurology rotation and see what we do. That being said, I found, I'm curious what other panelists think, it's kind of hard from the rotation to feel like you can figure out if you like it or not. I always thought it was like, I don't play tennis, but if you watch tennis, maybe some people find that exciting. I thought it doesn't actually look that exciting to watch the ball go back and forth, I guess, unless you really know tennis and it's really, you understand what people are doing that's skillful. But if you go out there and hit the ball around, whether you're good at it or not, it's kind of fun, right? So I think it's hard to watch when you don't know that much yet and get a sense of that looked boring, that looked exciting. So I will say try to get exposure to different elements of neurology, because what we all discussed is so different. Isiosa in the middle of the night is being woken up and getting on video and seeing someone and then running into the hospital. I used to do that, but don't do it too much anymore. And Julie is putting needles and electrodes on people and following the electrical activity in their nerves and muscles. And my most elaborate tool is a reflex hammer. So it's different, and you'll see different things. And many neurology rotations are inpatient. So you'll see one side of what we do, but as Julie said, so much of what we do and many neurologists do is much more in the outpatient setting. So where I went to medical school is very creative, and I haven't seen this elsewhere, where you did your 2 weeks of ward or consult or whatever it was, but over those 4 weeks, every student got pulled out for 1 week and had this kind of variety week where you spent a morning in epilepsy clinic, an afternoon in dementia clinic, a morning in Parkinson's clinic, an afternoon seeing EMGs, to really get a sense of, oh, wow, this is so different than in the hospital. These patients are able to tell me what's wrong with them. Sometimes in the hospital, patients are so sick neurologically, they're not necessarily conscious, they're able to communicate with us. Or you see patients who are maybe not maybe doing as well. And in the outpatient setting, you might see different things. Or maybe the outpatient setting feels slow to you, and you see in the inpatient setting, you're running, trying to keep up with Esiosa as she and her colleagues put a catheter all the way up into somebody's arteries in their brain and pull out the clot, and they were paralyzed on one side and they're better. And some people say that's a little too fast paced for me. I like to be seated in the clinic and see. So if your rotation is inpatient, you said it was kind of interesting, but not sure it's for me, do try to get some outpatient exposure and see those more longitudinal relationships we have with patients with Parkinson's disease or epilepsy or multiple sclerosis, where we are not just meeting them for a very acute, couple of days or weeks in the hospital, but knowing them for many, many, many years and knowing their families. In some cases, almost feeling like one of the primary care doctors for these patients, having these long relationships with patients. So I guess that would be my advice, to get exposure to different elements of it if you're considering it and you're not sure, because your rotation, you may just see one small slice of the pie and miss out on all the other elements, which might be more interesting or exciting to you.
Thank you, Dr. Berkowitz. I think I'm going to broaden this question a little bit more as well. So, general advice for medical students that are considering neurology, but if you have any tidbits that would be good for someone who may be an international applicant, or maybe someone who's still an undergrad and knows they're interested in neurology and they're just starting to get into med school and they're earlier in this process. Please share your thoughts on that as well, and we'll move on to Dr. Iguodaro.
Great question. I think the biggest, especially those who are really early on, like the undergrad, pre-med, or maybe medical students in 1 and 2, is to get exposure. And that exposure can come in many forms. Many of us are on social media. If you go on Twitter or X, there's the neuro Twitter group. There's neuro there's a lot of just neuro groups on Twitter, and you can reach out to us, follow us, add us, send us a message. There's a lot of different learning communities on social media. So that would be a place I would start first, just to kind of get an understanding of, what do neurologists like to nerd out about? What do they talk about? What are they learning about? I think after you take advantage of all that online material, then starting to reach out to some of us to say, especially those who maybe live more in closer proximity to where you're located, just ask and say, hey, look, is it possible for me to come shadow you, come rotate with you. I know a handful of neurologists, including myself, that have been able to bring students on campus and shadow and rotate. And I think that has been very, very fun. So I think those would be the biggest things. Taking advantage of all the free resources online, because there's a lot. Reaching out, asking to shadow, and then also paying attention to what is it that you enjoy learning about. For example, when I was in anatomy, I did not like learning about the bones. There's a lot of bones in the body. I didn't like learning about the bones. So I knew I wasn't going to go be an orthopedic surgeon. I knew I wasn't going to do surgery. I don't like cutting people open. I don't like blood. I don't like guts. I think paying attention to also what is it that you just enjoy learning when you're in your pre-med classes, when you're in your medical classes, when you're on service. And I think once you kind of put those pieces together, that can kind of help guide you toward what kind of career you want to go into. And I know people also talk about, okay, salary, job security. There are so many people who need neurologists. There's not enough of us to go around. So there's always going to be job security in neurology. We get well compensated. So I think from that standpoint, that shouldn't deter you from going into the field, because we need a lot more neurologists as the population gets older and more diseases start to manifest, especially in older age. So with that, that would be kind of the tips I would give people who are thinking about this career.
Thank you. And Dr. Schwartzbard, what are your thoughts on this?
Yeah, you stole my thunder a little bit, because I was going to give a plug for neurology. I mean, we really do need neurologists. You will always have a job, whether you're in a small community, an urban setting, it doesn't matter. We need you. We need you. But it is a cerebral specialty, right? We like to sit and think about things, like you said, as opposed to cutting things open. We're thinkers. And so if you feel like you're that kind of a person, then perhaps neurology might be for you. The other thing I think is really special and unique about neurology is this massive umbrella of diagnoses. And Aaron, you were alluding to that, you know, from MS to peripheral neuropathy to seizure to stroke. I mean, it just goes on and on. It's just so varied compared to other specialties. I was in the airport a couple of months ago, and I was in line to get a cup of coffee, and there was a woman between me and a young man who was wearing a medical school t-shirt. So, oh, you're in medical school. I started chatting him up, and what do you think you want to do? And he was thinking, well, I'm trying to decide between neurology and cardiology. And I said, oh my God. I said, why would you ever want to be a cardiologist? They are so boring. I mean, what is this? They've got, you know, electricity, they've got rhythm, and they got like pumping. I mean, that's it. And then the woman in between us said, hey, wait a minute, I'm a cardiologist. It was something that you could never have planned. But my point is that those of us in neurology really do get to appreciate such a vast array of different medical diagnoses and diseases. And it's something I think that is very special and unique within the field of neurology. And I stuck my foot in my mouth for not the first time.
Thank you so much for sharing that story and your thoughts on this, Dr. Schwartzbard. I've noticed a couple questions coming in about picking neurology versus other more general specialties, like family med or internal medicine, and even surgery in some ways. I know a theme that's come up in this discussion so far has been just how vast neurology is as a specialty. You can really customize your experience to what you're looking for. But how do you maybe tease out whether or not you're better suited for neurology versus maybe another one of the general medical specialties? And I'm going to leave this open for whoever would like to chime in first.
I'm just going to say to the person who's stuck deciding between surgery and neurology, there's no competition. It's definitely neurology. I mean, it's amazing to me that it sounds like it's someone who's looking to do procedures. So I will also add that besides EMG and nerve conduction studies, we do lumbar punctures. Those who are in the pain world, you know, epidural injections and things like that. We're not that ridden with procedures, but at the same time, there are those procedures if you seek them out.
I think to piggyback off what Julie said, and also to kind of add, someone asked a question about how did you choose between neurology and neurosurgery. I feel like that sometimes is like the first split that medical students make is, do I want to, am I procedure heavy, or am I more, not procedure heavy, but, want to do more analysis, physical exam, interpreting labs and clinical history. And I think it comes with experiencing, also figuring out how you want your day-to-day to look like, right? For me personally, I did not want to be in the hospital 24/7. I didn't enjoy being in the OR when I, did my surgery rotations. I'd rather do the physical exam and localize and look at imaging and try and figure out, from that standpoint, it's kind of like a puzzle for me. Oh, the patient comes in with these symptoms. Here's the neurological exam. Where do I think the lesion is localizing? So it was kind of a puzzle that I enjoyed doing in my head. So I think for me, that's how I picked. I just, the day to day for me, I enjoyed more the neurology day to day than the surgery day to day. So I think to answer that question, just really figure out what do you really enjoy doing, and then once figure that out, then figure out a specialty that allows you to do those things that you enjoy doing instead of trying to make yourself fit into a particular mold.
I think that's all great advice. Yeah, it is hard. Sometimes you get to the end of your third year and you think, really, that's it? I have to decide, the next 50 years of my life based on these sort of, speeding through all these different things for a couple of weeks. But one thing that I forget where I got this advice at some point, and maybe it was choosing a subspecialty rather than choosing, neurology versus medicine. But someone said, one thing you can do is just look up some journals, because people think of, oh, I'm going to be seeing a lot of patients in my career. That's definitely true. But you're also going to be keeping up with your field by reading journals and going to conferences. And just pull up the conference website for Society of General Internal Medicine or Society of Family Medicine, whatever the national society is, and then pull up the AAN, our national conference, our annual conference. It's an international conference, but annual conference, and just look through the talk titles. And it is funny that this gives a sort of interesting visceral response. Like you're looking through, and all due respect, some of my best friends are internists, be like, oh, hyponatremia, like, oh, gallbladder disease, approach to constipation, okay, urinary tract infections. And then you're like, oh, wow, approach to patients with speech difficulties, new latest treatments in stroke. And again, one person's hyponatremia is the next person's, acute strokes. And I'm sure my internist colleagues would find it maybe boring to go to a neurology meeting. Even I still find that hard to imagine, but it just shows you much of a neurologist. But I thought that was helpful advice to just sort of, go online to the Neurology Journal or other, journals in neurology, and just start leafing through and seeing like, oh, actually, all these paper titles look interesting. I don't know what they mean, but this looks kind of cool. Or go look at the AN. I think if you look at the AN program, you'll definitely want to come. We do lots of fun and cool things at that conference. But that gives you sort of a feel of what people in this field are excited about, and that can give you a sense. And I think, just talking to people in those fields and seeing, as SEO said, how much you feel you relate to them. I mean, surgery is a very particular thing. And I think a lot of people who become neurologists thought maybe about neurosurgery at some point. They're both the brain, and neurosurgery seems like this kind of amazing, incredible Olympic sport type of thing to perfect. But as you meet people and talk to people, you get a sense that it's a very different way of life. You're spending most of your time, in the operating room, operating, in the space of inches, and must be extraordinary to develop that level of skill. It also, the residency is about twice as long. So how long do you want to be in training, and how old are you when you are going to get out? If you're starting very young, that may be less concerning. If you're older, that might be more concerning. But they are different, and it sounds exciting to operate on the brain. And you think, oh, I only see pictures of it. I only examine the patient. But like Isio said, I love talking to patients and thinking, oh, by the time I'm done talking to them and examining them, I'm going to have a pretty good sense of what's going on. And that, I realized over time, was more interesting and compelling to me than, as exciting as it seemed and sort of incredible as it seemed to think, I'm going to talk to this patient for a few minutes and then I'm going to cut open their head and see their brain. I mean, that's pretty wild, but that didn't necessarily appeal to me. But yeah, I think some windows in are just getting a sense of not just talking to people, but kind of imagining yourself forward beyond the day-to-day by leafing through journals or looking at conference websites and seeing if that, what things kind of resonate with you.
I love that advice of looking through medical journals. I had not heard that before, but that's really an excellent way to determine whether you enjoy reading about this topic that you're hoping to devote your life to.
I don't want to take credit for it. Somebody gave me that advice at some point, or I heard them giving it to someone else, and I have perpetuated it. And yeah, people seem to find that. I think you'll find you'll react, right? Go leaf through a medicine journal or a neurosurgery journal or a neurology journal and say, this is cool. I could see reading about this for the rest of my life. Or, well, no, maybe not.
For sure. To develop that idea, how do you best stay up to date in your field? How do different neurologists learn more about their subspecialty? And this is just open for all of you. Whoever would like to chime in first, please go ahead.
Yeah, we need to read. Of course, we read all the time, but I have to give a plug to the AN. I mean, the fact that they're doing this program right now, right? And remember, when you pick a specialty, you're joining a community. And those of us in neurology within the AN, it's an extremely collegial atmosphere, and it's sort of like we have an immediate bond with each other. And the conference, both the fall conference and the spring conference, are just an amazing wealth of not just information, which you asked about, but true bonding and collegial interactions with our fellow neurologists from all over the world.
That's great. Any other thoughts?
Yeah, I try to yeah, I advise residents also. There's a couple of things. One, the best learning comes from our patients, because it's what you learn in the context of taking care of a patient is just so memorable. So if you see a patient with something you didn't know about or realize you don't know as much about, to find resources to read directly about that patient. I call that sort of like the vertical learning, and then horizontally you have to learn neurology, and then you have to keep up with neurology. So the AN publishes a journal called Continuum, which is specifically for continuing to keep up with neurology, and it goes through every topic in neurology every 3 years in a sort of curriculum like that. So they come out 6 times a year, so it's 6 every 2 months. So even if you fall behind and you realize, oh, I have 2 now, but I have 2 over 4 months instead of some journals. If you get New England Journal or something, if you fall behind, it's coming every week. You realize, okay, need to put some in the recycling, and from now on, I'm going to read it, and then a little more difficult. So I call that more the horizontal, just kind of keeping up with everything. And a lot of journals, I realized you can't read everything all the time, even if you want to. In some journals, I get the table of contents, and I used to try to read everything. It's just not feasible, but I get a lot of tables of contents, and I'll scroll through the New England Journal. Most of it's not neurology, but if a big trial comes out, many times it's in the New England Journal, and then I'll put that on my reading list. But most of what I read is, I hear someone tell me something about a case, or they say, we just diagnosed this. And I say, oh my goodness, there's already another antibody from Mayo Clinic. I'm already behind. I got to read about this one. And amazingly, and none of us have said this, so I think worth saying for those thinking about neurology, neurology is changing really fast. I've only been doing this for 10 years. And I remember when I was a student, I asked my neurology mentor, some people say neurology is too depressing and there's not enough cures for things. And I remember he said, well, in your lifetime, they're going to cure Alzheimer's, and you'll see it's in the future. And you think, I mean, maybe, but if it's so far in the future, and I think that's not fair. We actually can treat a lot of diseases very effectively: stroke, Parkinson's disease, migraine, epilepsy, multiple sclerosis. But the cool thing is, even not having done this that long, we're talking about keeping up, but I think it's worth mentioning how cool this is. Not only have a lot of new drugs come out, but new diseases have been described since I've been in training that I've heard about on podcasts or read about, and then been able to diagnose patients who've been going all over trying to find a diagnosis. And people say, how did you know what that was? And I say, actually, I heard about it on a podcast, and I looked it up because I'd never heard of it. But antibody-mediated diseases in neurology, a lot of new immune-mediated diseases newly described, infectious diseases with the advent of metagenomic sequencing. It's pretty extraordinary when students say, well, what's the most exciting thing? You don't always realize this as a student going forward, but Tell me another specialty where there are new diseases being described. New chemotherapy, sure, new heart failure drugs, but entire new diseases that didn't exist when I was a student a few years ago. Not a few anymore, but say 15 years ago, there were 2 drugs for multiple sclerosis. How many are there now? 20 something drugs. So the brain is the final frontier, right? We still don't really understand much of it, but there's so much evolution, which is so exciting that, even stroke has changed so much that, when I was a student, there wasn't too much to do, and then there was thrombolytic drugs, and now there's thrombectomy and new ways to figure out the etiology. So I can't, I know we're all biased for neurology, but I think most would objectively say there's entire new fields of neurology that have emerged in the last few years, and that's so exciting to try to keep up with.
It's great to hear. I can see that we're getting close to the end of our time, so I want to remind students in our audience to utilize the Q&A feature. We've had some amazing questions come in there, and I hope we were able to address the heart of what you guys were asking. But any last-minute questions, feel free to drop them in the Q&A, not the chat, the Q&A function below. Any last thoughts about staying up to date in your field, Dr. Iguodaro?
I think a lot has been said already. I will also, for me, I love social media. And so I'm like, if I'm driving, or how can I get a lot of information quickly outside of reading a journal or reading an article? There's a lot of podcasts. I know that the Continuum, there's a podcast, AN has a podcast. Dr. Berkowitz has a podcast that I love listening to. There's a lot of neurology learning out there on podcasts that's free. So I would recommend students, go check out those podcasts. And YouTube. I've learned a lot of neurology on YouTube where, my professors, they'll talk about, for example, how to read a scan. And for me to get more information, I would go on YouTube and just type in how to read CT scan. And there's a lot of professors who have put their lectures online for free. And I would just go and just listen to all the YouTube lectures. But I think a lot of us neurologists have started leveraging social media to help put our material out there and help teach the next generation of neurologists. So I would plug social media, because you can learn a lot real quickly when you're doing errands, driving, or in between patients.
Put it in the chat, but make sure you follow Iseosa. She's talking about this, but she's also leading the charge here. She has so much online content and case discussions and lectures on YouTube that she's all generously developing and putting out into the world for free to learn from. It's phenomenal, and it's very humble. So she's not going to trumpet it herself, but you should follow her on Twitter, and there's all sorts of links that she has to her website and YouTube, and you can learn a lot of neurology from her. Yeah.
Thank you.
So I'm seeing in the chat a couple questions about DOs in the field. I'm also an osteopathic medical student, so I can say that there are definitely more DO students that are interested in pursuing neurology than before, which is amazing, and I hope to be one of them soon. Overall, when it comes to advice about taking particular board exams, the MD versus DO board exams to be a competitive applicant, I'd really suggest deferring to your school advisors on that one. A lot of the advice, it has been changing over the recent years, and especially with pass-fail step 1 and such, there are varying advice from different schools. So I would follow what your school advisor says, or reach out to more recent folks. If there's a particular program that you're interested, get in touch with that program and kind of get a feel for what their culture is about, and see if they have a particular preference one way over another of step versus complex. I hope that answers your question. Since I saw a couple folks chiming in about that DO bent as well. Are there any thoughts from our panelists on that? No worries at all. Okay. And I think for our final question, I want to ask if there's any thoughts that you have about work-life balance, particular to the field of neurology. I know it changes with where you are in your training as a resident or a fellow is different from what it's like as an attending, and it can vary based on your subspecialty. But any overall thoughts you'd like to contribute about work-life balance before we wrap up? And I'll turn it to Dr. Berkowitz.
Okay, in 1 minute or less. Well, as I alluded to earlier, I left medical school because I didn't think I was going to have the work-life balance I wanted pursuing medicine from how it looked to me as a medical student. This is before work hour restrictions were passed and people were working, over 100, 120 hours a week in the hospital. And so I left for a long time and came back still a little frightened if even 80 hours is still a pretty long work week, twice the usual work week. Not that you work that much every week. I think one thing I've learned that when students ask me, I really have these outside interests, outside of medicine that I want to make sure I have. I think we have this image of work-life balance as every day. Every day I do all these things and to work, and then I exercise, and I read, and then I play the piano, or I knit, or I do yoga, or I train for a marathon or whatever. But I've come to think about work-life balance more over larger epochs of time. Like residency is about working because it's also about learning. And if you're trying to, as I try to do, squeeze in all your outside interests and all your spare time, you're actually not necessarily learning as much medicine as you can from the experience. So as hard as lesson that was for me to realize, and I resisted it for some time, I think that's a helpful way to look at it. And there are periods where I'm doing outpatient and I have a lot more free time, and I'm thinking, oh, I have a lot of free time, I should do all these things. And then times that I'm in the hospital, and on call and these things where I think, if I try to squeeze all these things in, it just feels like I don't have work-life balance. But actually here, when I'm fully immersed in the work and kind of in that flow state of clinical work and teaching, it's actually very fulfilling and gratifying. And then I'm also happy after 2 weeks to get back to some of my hobbies. So took me a long time to learn this lesson. I'm not sure I could pass it on, and you can accept it. Maybe you have to live it first, but to just think about work-life balance, not over every day or sometimes even over every week, but there are harder weeks and easier weeks, and there's vacation and there's the opposite of vacation, and there's everything in between.
Thank you. Any last thoughts about work-life balance from Dr. Schwartzbard?
We'll save that for part 2, I think.
Sounds good. And thank you so much. And to Dr. Iguodaro, thank you so much for your time. I really appreciate all of the insight from all 3 of you panelists. Thank you so much for participating, and have a great rest of your night.
Good night, everybody. Good luck
Thanks.
to all
Hope
of
you
you.
join us in neurology.
Night.